Welcome to safer surgery for you and your patients. Introducing the SurgiCount Safety Sponge System, a solution clinically proven to help eliminate one of the most common yet preventable surgical errors: retained surgical sponges. The system is comprised of three components: the SurgiCounter, a small mobile computer and scanning device; safety sponges, a full line of X-ray detectable surgical gauze sponges, laps, and towels; and SurgiCount 360, a back-end surgical data management tool. Together, the components help eliminate retained surgical sponges by providing more accurate real-time counts in the operating room, as well as provide auditable, post-operative, evidence-based outcomes through a complete documentation solution. The SurgiCount Safety Sponge System utilizes barcoding, a simple, safe technology already used successfully throughout the healthcare industry today for a variety of patient safety and other purposes. The SurgiCounter displays the number of each type of safety sponge that has been counted in, the number that has been counted out, and the number left or remaining to be accounted for. Additionally, the SurgiCounter can tell surgical staff not just if a certain sponge or sponges of a certain type are missing, but exactly which individual sponges have yet to be accounted for. The Safety Sponge line of disposable products includes a full line of X-ray detectable gauze sponges, laps, and towels of numerous shapes and sizes. Permanently fused to each safety sponge is a barcode label that can be easily read by the SurgiCounter despite the presence of blood or other body fluids. Each barcode label has an individual code permanently printed on the surface, making each safety sponge unique from all others. Scanning the master tag inputs all the individual safety sponges in that pack into the SurgiCounter, allowing for quick, simple scanning in of an entire pack of safety sponges. Once a case is over and the SurgiCount report closed, by placing the SurgiCounter back in its charging base, the reports can be automatically downloaded into the SurgiCount 360 software application. Once in SurgiCount 360, the individual reports are aggregated into the database and can be viewed post-operatively for a variety of purposes. The system is used in conjunction with a manual count, not a replacement. It is there to support, document, and validate the manual counting protocol and promotes adherence to AORN recommended practices. Current users of the SurgiCount Safety Sponge System include a large and growing number of community, government, and teaching hospitals, including 6 of the U.S. News & World Report 2011-2012 Best Hospitals Honor Roll recipients, and facilities of all shapes and sizes throughout the U.S. The Safety Sponge System is validated by the largest clinical study ever published on retained foreign objects. Completely independent in nature, the study was published in the February 2011 edition of the Joint Commission Journal on Quality and Patient Safety. Entitled, "Using a Data Matrix-Coded Sponge Counting System Across a Surgical Practice, Impact After 18 Months," this multi-year study does a deep dive into the issue of retained surgical objects, the selection process this institution went through in deciding on an approach in an attempt to reduce this error, and their experience using the Safety Sponge system post-implementation. Key results from the study include: use of the system took their occurrence rate from 1 every 64 days prior to implementation to 0. Over 1.9 million safety sponges were used in more than 87,000 procedures, and none were retained. The solution caused no workflow disruption or increase in case duration. Staff satisfaction and trust in the system was high, and it was found to be highly reliable and cost-effective. As a follow-up note, it has now been almost 3 years since this facility implemented the Safety Sponge system, and they are still where we all wanted them to be: 0. We have an established, proven process to ensure a seamless implementation of the Safety Sponge system in any facility. We provide complete pre-implementation, go live, and ongoing support and service for all areas that are involved with the system, namely supply chain, clinical, and IT. Like all X-ray sponges, laps, and towels used in hospitals today, our safety sponges come in both custom procedure trays and in single sterile packs. We work with all kit providers and distributors, so hospitals do not need to alter their current supply chain partners to adopt our solution. Our clinicians will come to the facility prior to and during the go-live date to in-service and educate the surgical staff and make sure all are completely comfortable with the use of the solution. Prior to the go-live date, our IT technicians coordinate with the facility's IT staff and administrators who will be using SurgiCount 360 to ensure proper functionality and comfort utilizing this powerful data tool. The SurgiCount Safety Sponge System, protecting patients, surgical staff, and hospital bottom lines.